Hi everyone, it's Lori Brown, nurse attorney with empowerednurses.org and yournurseattorney.com. Today I want to talk to you about a trend I've been noticing in Indiana for nurses getting in trouble. What's happening now is with the Pyxis, and when they audit the Pyxis, they are looking for several things. One is, are you an outlier? Are you taking more drugs than somebody else? Number two is, are you holding onto the drug before you administer it? Never ever pre-pull meds. That is a no-no. Immediately, once you pull the meds, go take it to the patient. I know that in nursing, we want to be efficient. We do things ahead of time to stay ahead of the curveball, but in this case, you can't do it. It's just not going to work, and they're going to wonder why you're carrying narcotics around in your pocket for so long. And just think about it. If you were carrying a Dilaudid 2 milligrams and you were only supposed to give 1 milligram or 1 cc, whatever, my math is off these days, you were only supposed to give half of it. You could have easily taken some of it for yourself and then just give the patient the rest, fill the vial with saline, and then say, oh, let's go waste it. So be very careful and think about these things. People who steal drugs are smart. They know the way to cheat the system, and they get away with it for a long time until they don't. But you don't want to look like one of them. So when you are wasting a medication, be sure that you waste right away. Don't carry it in your pocket. And I know trying to find somebody to witness the waste is difficult, especially on units where there's only 2 nurses, or on units where the Pyxis is far away from where your patients are. But as soon as you need to waste it, grab somebody, go waste it properly, and then immediately document the waste. And make sure your witness watches you waste. I've had witnesses retract, say, yeah, I signed it, but I didn't actually watch her. So be very careful of that. So again, narcotics are such a big thing these days with the opiate crisis, and I just want to make sure that you're safe and you're protecting your license. So to review, don't be the outlier. Don't give your patients more drugs than anybody else. And I know I was taught, always stay on top of the pain, always give them their medication so they don't have that breakthrough pain. And unfortunately, nowadays, it's harder to do that because you don't want to look like the outlier. So make sure your patient asks. Say, for example, you pull some medication, you get to the patient's room and they're sleeping and you don't want to wake them up. Don't carry that medication around. Immediately just go back and return it to the pharmacy, document in the record that you couldn't give the medication because the patient was sleeping, but he asked for it and you didn't want to wake him up. And then make sure when you waste a medication that the person actually witnesses the waste and that you waste it immediately so that there is no time delay between administering the medication and then witnessing the waste. And when you witness waste, make sure you're actually witnessing it and sign for it. There have been situations where both parties have been taken for drug screens and maybe the witnesses turned out positive for the same medication that was missing. So protect yourself and protect your coworkers and make sure you actually witness the waste. And lastly, most importantly, when you take a medication from the Pyxis, make sure you scan it into the patient. Again, I've seen a number of cases lately where they have not immediately scanned the medication for the patient, or the scanner wasn't working or whatever, and the medication didn't get signed out, or they gave it to the coworker to administer it. You're the one that's responsible. If you take it out of the Pyxis, you administer it to the patient and sign it out. And just if you do these few steps right, you will never have a problem. You'll never look like somebody who is questionable because you're going to be following the rules, following the policies and procedures, and doing it right. And yes, it may take longer, but doing the shortcuts will cost you in the end, and it could be your license. So protect yourself, protect your license, and do things the proper way. Thanks.